Hi, I'm Andy Miller, and I'm here to talk about my favorite articles from the August issue of Respiratory Care. A little bit about me. I'm the section editor for Respiratory Care for Pediatrics. I'm also a respiratory therapist and ECMO specialist at Duke University Medical Center, and I'm chair of my department's research committee. So the first article I'm going to talk about is from Rich Kallet, and it's called The 2020 Year in Review, Mechanical Ventilation During the First Year of the COVID-19 Pandemic. And this is a fantastic review article. It's almost encyclopedic in how much knowledge that is in this paper. He reviews every single paper that's been published and a lot of the rationale between the H and the L phenotypes and various other factors that go into COVID-19 management. And in the introduction, he says, "What do I know?" Which is a good question. We only know what we know. And as we go, one of the big questions for COVID-19 is to intubate or not, and when to intubate. Should we intubate early? Should we intubate late? And he reviews all the literature on this to say the pros and cons of when to intubate and why to intubate. And then the other big question that's come up with COVID-19 is this truly ARDS, or is this some new disease? And I think at this point, it's reasonably well established that it is very similar to traditional ARDS, but it was very controversial at the beginning, and he covers all of the L and H phenotypes that were very controversial at the beginning of the pandemic. So the second article, this is actually from our team. This is Rachel Gates's very first publication. And we looked at high flow nasal cannula and pediatric critical asthma. So this was not a clinical trial, but a retrospective cohort study with propensity score matching to compare outcomes for those treated with high flow nasal cannula versus aerosol face mask. And what we found is, you can see in the flow chart here, we treated 67 patients with aerosol mask, 104 with high flow nasal cannula, and then we compared outcomes. So the primary outcome was hospital length of stay, and what we found is that there was really no difference in patient outcomes between high flow and aerosol mask. You can see here there's a very nice graph that you can see over time as our asthma scores are similar at baseline and they improve kind of at a similar rate over time, which kind of indicates that if you're using high flow nasal cannula for your pediatric asthma patients, they're going to do about as well as those treated with aerosol face masks. And then finally, the last article is the change in frequency of invasive and non-invasive respiratory support in critically ill patients. This is a very interesting paper that looks at changes in invasive mechanical ventilation versus non-invasive support, which is primarily CPAP, non-invasive ventilation, and high flow nasal cannula. And what they found is a pretty significant increase in non-invasive therapies in the PICU setting and a decrease in invasive mechanical ventilation over time. So this is a very good study that kind of indicates similar to what we're seeing in our facility, which is an increase in non-invasive support, primarily high flow nasal cannula, but also non-invasive ventilation with a decrease in invasive mechanical ventilation. And then you can see here, I'm not going to belabor this graph, but you can see fairly clearly that the non-invasive support goes up, 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 and the invasive support goes down, 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 and then high flow goes up, 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 up. CPAP goes up a little bit, and then BiPAP goes up quite a bit as well. And then thank you. Those are my favorite three articles. You can email me at andrew.miller@aarc.org. You can follow the journal on Twitter at Respiratory Care, at RespCare, and you can also check out our Facebook page. Thank you.